Good morning and welcome everyone. Thank you to those who have started putting their job roles and introducing themselves into the chat. That's fantastic. Thank you very much. Just to let you know that the session's recorded, as we've had a number of people ask for the recording who've been unable to attend. So we've got a few more people joining us, and if you'd like to keep muted, and please use the chat box for any comments. Okay, so for those of you who aren't network members, there's a QR code on the page, and you'll hear a lot about the Child Health and Wellbeing Network as we go through the different areas. My name's Amelia Soulsby. I'm a network development manager, and I'm going to explain a little bit about the network, set the context, and then hand over to our chair, Professor Judith Rankin, who will share a bit more about the work. So we can have the next slide, please. So who's in the room? There is a whole range of professionals joining us from across the system, which is what the network is all about. So welcome everyone. If we move on to the next slide. So that's me, my role, and I'm just going to go through a little bit of the background. So what's happening here in the Northeast in North Cumbria. So we know that children are around 20% of our population, and we know that they're 100% our future. There's a lot of information coming around about how areas of the Northeast and North Cumbria have the highest level of child poverty in England. And we know that there's reduced resource and capacity across the region. We've got high rates of childhood obesity and also high rates of A&E attendance for 0 to 4-year-olds and highest rates for asthma admission. So we're setting the scene to say that actually there's a lot going on in our region. There's a lot of work to be done. So then there's quite a few challenges around collaborative approaches and reaching our most underserved communities, around data, about system-wide engagement, and most importantly, upskilling frontline workforce. So we have the next slide, please. So the network was formed in 2018, and it was initially initiated by the setup of the ICS. And our clinical leaders had a vision around taking a village. It takes a village to raise a child. And we went through a transformational change program, and it was inspired by Marshall Gans. There was a core system leader group who was set up, and they did a lot of work around the system priorities, which we'll explore in this presentation. So in 2021, we developed our work plan and sourced funding for different partnership working, including our poverty proofing work with Children Northeast and our Tackling Inequalities programme. We promoted and shared good practice through a range of different huddles and our newsletters which came out, and also the NHS England CYP transformation programme. We expanded in 22-23, and we had our apprentices join us, and our youth board was developed through working really closely with Children Northeast and local authorities. And we had our ICB work streams, which you'll see as we go through the different areas. And then we've got the core 20+5 work for children and young people, and we also have a range of system leaders who joined us. And currently, we're looking at setting up an alliance, which has been paused for the moment. We've moved into the integrated care board, so we're part of the ICB, and we've got our young advisors manifesto, which they've created. So if we have the next slide, please. A little bit about our foundations. So what are our principles? So our shared vision is around in the Northeast and North Cumbria. We believe that all children and young people should be given the opportunity to flourish and reach their potential and be advantaged by organisations working together. And what we were asked to do was to share good practice, drive work forward, and connect us into expert groups. And our Huddle program is a huge part of that. So if we move on. So there's a range of different areas of focus, and this is changing. It's always changing as things develop, and there's just a few statistics that you can look at. If we move on to the next slide, there's just a bit of background about the populations within our region, and we'll share the full slide deck with you after the event. So on the next slide, there's quite a helpful document here called The Facts of Life in the Northeast and North Cumbria, and this was it's a range of statistics that was produced in 2021, and it just gives you a bit of background using fingertips data of what's happening in our region. And as you can see from the bottom square, the bottom table, there's a lot of red there, and the detail is available on our website, and the link we'll share with you afterwards. So the next slide. So we've got around it's over 1,900 members from across the Northeast and North Cumbria, and that can be anyone working with children and young people. We've got a network of advisors who support our system, and we've also got our youth board who met last week pre our adult executive board. We host a range of events to share good practice, and those include a range of national and international speakers who have some amazing work that they want to share with the Northeast and North Cumbria. We have Child Health Tuesday Bulletin, so I'd highly recommend signing up to receive that. And then we have our newsletter coming out in the next month. Okay, so the next slide. The little final point from me is our youth board manifesto. So our young people met, and over the past year they've worked with our executive board to create their River of Change artwork, and these are the points that they've raised as important, and we are really, really excited to be supporting them with this work. And the link at the bottom, that takes you to a YouTube clip of one of our young people explaining in detail about the manifesto and what it means. And keep watching and see what happens with that. So finally, just a final comment from Sir Al Ainsley Green, who's one of our supporters and has been with us since the beginning, before I hand over to Professor Judith Rankin, who is very kindly agreed to chair our event today. So Judith is a professor of maternal and child health within Newcastle University in the Population and Health Sciences Institute. She leads on the NIHR Applied Research Collaborations Northeast and North Cumbria's Supporting Children and Families theme, and is also a member of our executive board. Her research co-creates across sectors, directly supports the Better Start in Life programme and continuities of care across childhood, and her aim is to develop and implement evidence-based integrated prevention approaches in maternity and child health to improve equality in health status, access to care and outcomes for parents, children and families. So thank you very much, Judith, and I will hand over to you.
Thank you very much, Amelia, and thank you for taking us through the work of the Child Health and Wellbeing Network. I'm going to start with a plug and end with a plug. So if you aren't already one of those 1,900 members, then I would really encourage you to join up today. But on to today's huddle. Thank you all very much for joining us. This huddle is specifically looking at father and male carer inclusive practices. But before I say anything more about that, I'd just like to do some housekeeping, really. So you've got the agenda in front of you. We've got three speakers, but 4 sessions, which will provide the detail behind this huddle. And what I'd like to ask you to do, is, if you didn't mind, was to hold your questions. Please think of lots of questions and comments. Either put them into the chat or wait if you can until the question and answer session, the discussion session that we'll have later in the morning. So we'll have about an hour, 55 minutes to an hour of presentations, then we'll have a short comfort break, and then we'll very much come back and go into discussion mode, and that will be the opportunity to ask our speakers any questions that you might have, or also we'd be really interested to hear about your own experiences within your work, and also any work that you might be starting or speaks directly to what's is been happening here in the Northeast. So use the chat, that will get picked up in the background, so don't worry, it won't get lost in the ether. We will hold all those questions to the next session. So today's focus, as I've said, is really around fathers and male carers. The evidence suggests that if a father or male carer is present and exerts a positive role, that this really can improve the outcomes for babies. So the purpose of today is really to look at a new approach, a new service that's been developed, hear about it, and also to share practice and comment about how we can really explore a different approach to including fathers and male carers and what that might look like for, as I've said, to improve outcomes for babies. So I won't say too much more. It's much more important that you hear from our excellent speakers. So I'm delighted to welcome all of them, and particularly in this first session, to introduce Sarah Robson, who's the Fathers and Male Carers Enhanced Service Coordinator at Barnardo's, who's going to talk to us about the father and male carer inclusive practice. So I'll give you a moment just to maybe load the slides, or if they're going to come on next. Brilliant, beautifully timed and beautifully prepared. And then I'll hand over to you, Sarah, to introduce yourself a little bit more and then to hear about your journey so far with this practice. Thanks very much, Sarah.
Thank you so much, Judith, and good morning, everyone. Thank you for coming along today and taking the time out of your incredibly busy days to join us and hear about the work that we've been doing. Just to give you a little bit of context, I came into post in April of last year as the Young Fathers Coordinator for Newcastle. I was carrying a bit of a caseload and also having a bit of a strategic approach to how services can embed father inclusive practice in everything that they do. As part of that, we did consultations with young dads and with professionals. When I say young dads, I mean 25 and under. And what became really obvious was that actually some of the challenges they were up against did not just apply to them because of their age, it was across the board. That was taken back to the commissioners, who've been fully supportive of everything that we've been doing, and they very kindly changed the contract. So that is where the new job title comes in, Father and Male Carers Enhanced Service Coordinator. So I have a strategic role in the city where it's under the umbrella of children and families to look at how we can support services to better engage dads in their offer. Could I have the next slide, please? So as a result of the consultation, here's some of the things that dads are telling us. And just as a bit of a caveat to that, it starts off very bleak. And I hope that towards the end of the session, things seem a little brighter. So dads were consistently telling us that they didn't feel heard or included in the pregnancy process and the early years of their child's life in the same way as mums were. We understand that when a lady is pregnant, she is the patient. All of the records are kept in her name, and then records are transferred over to baby when baby's born. And there was very limited opportunity to capture dad's details within all of that. Dad's also talked about community spaces. It resonates in my mind loud and clear. Dad telling me, would you walk into a room full of blokes and feel really comfortable sitting talking to them? And when you reflect on that, you can kind of see where they were coming from. Dads tell us that all the information about their child goes to the mother and they're not included. We've had further conversations. I went along to Newcastle Hospital's Children's Safeguarding Board. There was a lot of conversations around children who were not brought to appointments, but systems only allowing one letter to go to one parent. So potential missed opportunities there for another parent to support. Dad's talking about feeling helpless when contact with their child is stopped by mum. We have ongoing exploration around how we can support with that. It is unfortunately a power dynamic, which is controversial to talk about. but dads quite often don't have rights over their child, even when they're on the birth certificate, and they have PR because birth certificates aren't held centrally anywhere. So how do we capture that information about who they are? And dads talking about their roles, it's a funny one, isn't it? Because we see more dads at the school gates. We see more dads engaging in activities, but there's still this societal unconscious bias around sort of what dad's role is. We kind of subconsciously lean towards the mother as the carer, the nurturer. She's the protective factor. The dad is the breadwinner. He's the earner. He's the hunter-gatherer. And that's not the case. We really need to challenge that. Could I have the next slide, please? So what professionals were telling us that systems and processes were actually a barrier to capturing dad's details. So while the willing was there from the staff, the system behind what they were doing didn't support that. Services have tried to start groups for dads, but they're not well attended, even when changes to the venue have been made. And by that, I mean very much the visuals. That subtle imagery is really powerful. Moving away from painting things pink. Let's have less posters of ladies. Let's have posters of men and women. We know families are diverse and we need to embrace that. Some mums were very uncomfortable with dads being in the same space as them, and it's understanding where that came from. So one dad talked to me, and he was the primary carer for his little girl. He talked to me about going along to a group session that was attended mostly by women, and actually being approached by a mother who asked him, "What are you doing here?" That made him feel super uncomfortable, and he didn't go back. The problem that we have then is if dads don't come back, the practitioners facilitating the sessions can't understand what happened there and speak to mum, speak to dad, and unpick some of that. Pathways for support for fathers presenting with mental health challenges are generic, slow, clunky. A caveat to that, following an event that we had last week, Talking Therapies in Newcastle have changed their criteria, and they now offer the same pathway of support in Newcastle to dads of young children as they do to mothers, because they recognise the gap in provision. Practitioners talked an awful lot about working with families and mum just not sharing who dad is, and that's a massive barrier. They were concerned about breaking the relationship that they had with the mother that they'd built up over time. The wall would come up, they would say he's not involved. The problem that we have then is that we're relying on one narrative, because again, we don't have dad's contact details, so we can't run it past him. Mums don't always want dads to be aware of service involvement and claim that dad is not involved, particularly in the social care arena. And Sarah Cartner is going to talk about this a little bit later on, but a lot of the work that we've been doing has been informed by an increase in infant deaths in the northeast, where evidence suggests that babies were out of routine during these incidents. And we talk about the word perpetrator, which makes me feel incredibly uncomfortable, because what we found was quite often these babies were out of routine. They might have been with dad, who didn't receive the same information as mum. But like I say, Sarah's going to talk a little bit more about that later on. Could I have the next slide, please? What does life look like through the lens of a dad? There were so many elements that we could come at with this. The relationship that he has with the mother of his child, opportunities to learn about parenting and have information shared with them. Unaddressed birth trauma, we're hearing about that more and more and more. Even when labour goes well, baby's born, everything's fine. Dad just didn't feel quite prepared to see all of that. And when things don't go quite so well, services are very quick to get into action, because the priority is keeping the baby safe, getting the baby into the world safely. And dads can quite often feel that they weren't part of the conversation, they didn't know what was happening, and they could be left for hours at a time feeling really frightened. Their whole world was in another room and they didn't know what was happening with them. Postnatal depression in men is a thing. Massive reduction in testosterone can impact their mood post having a baby. Understand how to support a partner who might not be feeling okay. So, having a conversation about how childbirth can impact a woman, and how a dad can be supportive in all of that. We have a fantastic suggestion, which again, Sarah will talk about later on, but, making dads feel like they are never not needed. A fast return to work, so government guidance is 2 weeks. So you can imagine, as responsible employers, if we had somebody working for us operating machinery who was drowsy because of the influence of medication, we would be safeguarding that practitioner. Yet we don't make considerations around a dad who potentially has birth trauma, has had 2 weeks off, 2 weeks of incredibly broken sleep, which newborn babies bring to everybody who's had anything to do with them. And then they're expected to go straight back into work, function as normal, but with the added societal pressure that now you really do need to earn to provide for your family. Dad's rights to work to attend appointments. So prior to a baby being born, dad's only entitled to 2 appointments that he can attend. And generally they choose to go to the scans because this is when they feel connected to the baby. And how dads feel welcomed into community spaces by professionals and peers, we touched on that before. A feeling of disconnect from their child in the 1001 critical days. Again, you are never not needed, but are we talking to dad about what he can do if mum is breastfeeding? If everything seems to be focused around that, there's so many other ways that dad can interact with the child. Societal expectations, we've talked about that, and then just add on top of all of that everything that's going on in the country right now, cost of living crisis, housing crisis, all of those additional factors. Could I have the next slide, please? Thank you. So some of the benefits of changing the way that we work. Next slide, please. Thank you. For professionals, sometimes it can feel like an additional task when people are working at capacity, but actually exploring who dad is. If we think about it, that actually dad and paternal family are a support for families who might be struggling. So you imagine mum who might have 3 children under 5. She needs to do the nursery run. She needs to do the school run, possibly a newborn baby there. It's a real struggle. Is there somebody within paternal family who could support rather than practitioners feeling that, you know, there is a gap that they need to fill? An opportunity for earlier intervention. We had a great talk last week from Anthony McCardle at Newcastle Children's Social Care, where he talked about the difference between knowing dad and knowing who dad is. So we have a name, we know what job he does, we know his involvement. Is he a good dad? Is he a bad dad? That's the general kind of gist of the information that's collated around fathers. But actually, do we really know dad? Do we have conversations with dad? What support does he need? What does he bring? What strengths does he bring to the family? And dads are a protective factor, and I'm going to talk about that in a little bit because there's so many aspects we could approach this with today, and I've decided to go with safeguarding from my perspective. And in the workplace, how are dads and male carers who work alongside, do we ask them, are you okay? Are you shattered? You know, what can we do? Do you need something flexible? Do you have to do a school run? Do you have to go to an appointment? Next slide, please. Thank you. So for fathers and male carers as well, validating their role within their child's life, bonding and attachment. If we can validate and empower dads, then they can feel confident in building relationships with their children. Co-parenting dynamics, equity in parental roles, recognizing the strengths that dads bring, positive male role modeling, challenging gender stereotypes. So let's break that cycle of that's not what blokes do. And we can only do that by passing that on to the children that we're bringing into the world. Health benefits, improve mental health, well-being, reduce stress, and personal growth and shared experience. An opportunity for personal growth and experiences and knowledge that they learn and they gather and develop along with the growth of their child. Next slide, please. Thank you. And then for babies, emotional development, cognitive development. It was quite controversial talking about this sometimes because we're conscious of how many families are brought up where a single parent household, and we sort of look at statistically that's more often than not mum. So what does that look like for children when we're kind of saying, well, actually your outcomes would be improved if you had a positive male role model in your life? But what we understand is men communicate in a different way, they talk in a different way, they play in a different way, they problem solve in a different way. And all of these different experiences add to the richness of development of children. Next slide, please. And for families, shared responsibility. Reducing the workload, creating balance, a support network, multi-generational benefits. I know that Amelia just talked before about the recognition that it takes a village to raise a child. That is so true. But if we can tap into maternal and paternal family, look at the growth, look at all of that kind of relationship that can be built. Healthy relationships, demonstrating healthy relationships and positive communication with men, emotional support, and again, talking about positive role modeling. So let's challenge those outdated societal norms and let's challenge examples of what healthy relationships with men can be and should be. Thank you. Next slide, please. So these are some of the areas that have really come forward in the work that we've been doing. Safeguarding, weaponisation of children. We have many dads coming forward, looking for support, looking for advice around being disconnected from their child by a maternal family. Equal access to information and services. Spaces and places being equipped for men and their children. Gender equity. The mental health of fathers and male carers, and fathers and male carers in the workplace, which we just talked about before. I'm going to focus on safeguarding today. Could I have the next slide, please? So some of you may recognise some of the children in these photographs, and you might not recognise some of the others. I spent a long time looking through case reviews to try and collate information and get a real kind of spectrum across the board of learning and recommendations. These date from 2007 to 2021. Could I have the next slide, please? Thank you. The first one being Peter Connolly. I was super invested in this when it was first on the TV in 2007, not as a professional, but as a mum of very small children. I honestly can't remember Dad being mentioned. Maybe that's just me. I wasn't in the zone at the time, but actually Peter's dad was really vocal in that case. He talked about from day one, social services always took the mother's point of view, so much so I wasn't allowed to take Peter. I was never assessed as a viable carer, and we keep hearing this again and again, where dads and male carers are not assessed as viable carers for the children. I felt sidelined and extra in the play. He said that he talked to social workers with his concerns about the presence of Stephen Barker, who was the partner of Peter's mum at the time in the child's home, but no action was taken. He also claimed that he would have taken time off work to look after the little one when she was deemed unfit to look after the child, but social services did not consider him as an alternative option. Could I have the next slide, please? Harry and Elise, what I've learnt the more that I deliver this is that less people have heard about Harry and Elise. They were found in the boot of their mum's car. Their mum had killed them. And to summarise, it was what she saw as an ultimate act of revenge against the father to take his children away from him. The serious case review that followed the deaths of Harry and Louise highlighted that authorities might have been influenced by the mum's gender and class, and should remember that child abuse crosses all boundaries. So again, that subconscious bias leaning towards mother is the carer, nurturer, she's not the one who carries the risk, you know, quite a well-to-do family, all of those things that might influence our practice. It's just about critical thinking. Could I have the next slide, please? Aisha, there's a lot of recording about Aisha and the timeline of concerns around her death. She was murdered at the family home by her. She was living with her mum and her mum's partner. She was placed in a foster family around the time of her first birthday, but was returned to her mum in the October of 2013. She'd been known to social services all of her life. Her dad made calls to social services several weeks before she died, raising concerns that his daughter was at serious risk. Dad also shared photographs with social services of injuries that he'd seen on his daughter's face. When you look at the timeline of interactions with the family, the interactions with Dad are actually quite limited. When it was Dad who was ringing social care and sharing photographs and concerns about his daughter. Could I have the next slide, please? I always talk about Liam because sometimes there's a bit of a disconnect when these things happen in different areas of the country. Liam's from Wrighton, so he is very much within our geographical area. He was taken from his dad's house by his mum and moved up to Scotland, where mum moved in with her new partner. There was a disconnect created once again. Dad didn't get to see Liam. Contact was cut. and there'd been significant abuse and neglect, and unfortunately Liam lost his life. There was a second child found in the house as well who had also been neglected and abused. My understanding is that they survived. Dad talked about just being absolutely devastated when his little one was unexpectedly taken away from him. He had regular contact with them until around the Easter of 2012, and then there was an attempted reconciliation with his partner, and it failed, and the disconnect happened again. Could I have the next one, please? So Logan was much more recent in the news, and I don't know, people might be aware of Logan's dad, Ben, who campaigned tirelessly for Logan's Law. Logan's Law basically meaning that the other parent should always be informed, regardless of consent, anything like that, if there's any concerns about their child. Logan died at his family home. And he had been subject to neglect and abuse from his mum, his stepdad, and his teenage stepbrother. Dad talked about, for the past 5 years, I've been struggling and fighting just to see Logan. All I've wanted to do is just be a dad. I probably would have tried to take him away. If I can stop this from happening to anyone else, it will be the biggest, most positive thing. I'm yet to find out if Logan's Law was passed. I've been tirelessly researching that, but we live with hope. 17 years later, could I have the next slide, please? We've just had the reviews published around the two little ones in Durham who died in 2022. And I just want to highlight again, 17 years later. The recommendations and learning from the deaths of Maya Chappell and Dwelania Robinson was, again, we need to listen to Dad. We need to take what Dad is saying seriously. We need to be curious. So in both cases with these little ones, with Maya, Dad actually requested Clare's Law in respect of Mum's new partner because he had significant concerns around domestic abuse. Dwelania's dad went to the police. The caveat to that conversation was that he wanted nothing to be actioned, but he talked about domestic abuse in relation to him and his wife. But nobody was curious. Nobody asked more questions. He said he didn't want any further action, but nobody really dug down into what does this look like and what is the impact on the child. The dad did say Mum is a very good mum. What we understand is that Dad was actually out of the country when Dwelania passed away. Thank you. Could I have the next slide, please? So how do we get it better? What do we want to do? We want to empower dads and male carers, and we want them to feel heard, and we want to feel them to feel included, and we want to validate their roles in their child's life. We want dads to feel welcome in our services. We want dads to feel like they can come and talk to us, and if they raise concerns, that we will listen and we will action in the same way that we would a mum. Could I have the next slide, please? So on our journey to trying to change things, I'm going to give you a whistle-stop tour because Sarah and Laura are going to talk in more depth about what we've been doing. We've developed a Dad's Champions Network, which is professionals from services across the city. And again, I think this reflects the collaborative working under the Children and Families umbrella, because if we didn't do it together, it wouldn't work. Our Dad's Champions are that critical colleague within a service who might say to someone, "Where's Dad? What about Dad?" They will come to us with challenges, they'll come to us with issues that they come across, and we are very much a solution-focused working group. Within that, we will look at how can we support you, how can we work together, what can we change. It's such a positive group to be part of. Contractually, we were asked to recruit 10, we're up to 46. So that shows the investment in this work and how it's developing. Could I have the next slide, please? Thank you. So this is my three-pronged attack. I offer workforce enhancement sessions. One of them I have delivered to the Child Health and Wellbeing Network, all around father inclusive practice. My thinking is, if I can deliver to students, which I've been into college, I've been into university, and embed this way of thinking and this way of working before people go out into the workplace, we don't have to have those conversations around this is what we need to be doing. I've also been delivering to practitioners and really embedding that thought process that actually what we want to do is make your life a little bit easier. We want to reduce your workload. How about tapping into paternal family and seeing what resources are there for you, as well as consistently talking about the benefits for babies and children, because that is what we're all here for. I've also been talking to managers and senior leaders who have the sway, the influence over teams and services and how they operate, and their policies, processes and systems that they have in place to see where changes can be made to enable practitioners to do this work. Because I would reiterate what I said at the beginning, the investment, the eagerness to do this is there. Could I have the next slide, please? We're also being present at pop-up events at the RVI maternity unit where we're there specifically for dads. They are a little alarmed when we broach them with our lanyards on, but that's because they're not used to being approached by people with lanyards on. But we're super friendly and we give them an opportunity to talk. And Sarah's going to talk a little bit more about that later on because it's been fantastic, some of the outcomes of conversations that we've had. We're offering support and signposting to professionals across the city who are working with fathers, and we've seen a huge increase over the past, I would say, 2 to 3 months in dads actually asking for support and practitioners coming forward and asking where they can go with that. We've been collaborating on the development of new offers, one of those being the amazing Dads and Mini Mags with Newcastle United Foundation in Newcastle as an example. So that's a session specifically for dads to go along with their little ones and be in a really safe environment with good blokes where they can enjoy time with their little one and also have conversations with peers and get that low-level support. I have continued a reduced caseload of support for dads. That gives me a real live understanding of challenges and, you know, their experiences as they're moving through various channels in their life. 2 of those dads are going through court for various reasons around their children. So that really helps me to stay connected. We've been attending National Father Inclusive Practice Forums, so finding out what's happening right across the country, which is really exciting because this is not a Northeast issue. I would say it's a global issue. And exploring ways of collating data. So how do we capture all of that information about the work that we're doing with dads? Could I have the next slide, please? Newcastle Children and Families have really invested in us yet again. A huge thank you. So we now have a Newcastle Dads landing page on the Children and Families website, a place specifically where fathers can tap into information relevant to them. This has created an opportunity, which Sarah's going to talk about. If I could have the next slide, please. To have a platform for a resource for fathers. The resource for fathers, the thinking being we want dads to have access to all of the same information as mums. And that's a good time to pass over to Sarah. Thank you so much.
Thank you very much, Sarah, for sharing those incredibly important and obviously very tragic insights that you have with us. So we will move straight on. We're a little bit short of time there, but Sarah, I hope you can come in now. And so Sarah Cartner is a specialist health visitor for the 101 Critical Days and Solihull approach. Over to you, Sarah. Thank you.
Thanks, Judith. Hi, everyone. Yeah, so just to carry on from what Sarah was saying, I'll just do a quick introduction. As Judith said, I'm the specialist health visitor for 1001 Critical Days and Solihull approach in Newcastle. Which is a post that I started in March, much like Sarah's, and funded by Start for Life. So I'm involved with a lot of things that are going on sort of citywide, such as the infant mental health strategy. I coordinate the Solihull training for practitioners, which is open to everyone in Newcastle and is a free course. We're looking at Baby Week and also Lunch and Learns. But in regards to the father inclusive practice that we're looking at with Sarah, I'll touch on some of the things that Sarah's mentioned earlier. Could I have the next slide, please? So I know Sarah briefly mentioned about the RVI Dads events that we're doing. So by background, I am a midwife, still a practicing midwife, as well as a health visitor in Newcastle. So last June, I think it was, I had decided to sort of create an event trying to access more dads. I think, you know, historically, a lot of the thought is that dads don't really engage with services, with health services, baby clinics, that sort of thing. But actually, it's more that services don't engage with dads. You know, a lot of our services are Monday to Friday, 9 to 5, when dads are already back to work. As Sarah mentioned, sort of legally, dads are only entitled to 2 appointments, yet have sort of 8 to 10 midwifery appointments, including the 2 scans throughout pregnancy, as well as a health visitor appointment in pregnancy, as well as antenatal classes that we now offer. And then obviously we have the postnatal ones. So it's very difficult for them to be able to feel involved with what we're trying to do, and sort of those developmental checks with their baby, so that they can know and have an understanding of what normal baby behaviour is. So the dads events came on the back of that, trying to sort of get to dads a bit sooner. Since COVID, within health visiting, we do have a lot more dads attending the antenatal appointment than previously. I would say that's probably starting to reduce slightly now that a lot of people are back into the office and aren't working from home anymore. But we do really encourage dads to attend these antenatal appointments. So the purpose of this was to sort of just try and have some earlier conversations with them. Ideally, when they were attending with partners for scan appointments, as Sarah said, dads tend to attend the scans more than any other ones. But it was very much deer in the headlights moment as we were approaching them. So at the RVI event, it's held in the maternity unit and we hold it quarterly. I have a lot of people who come along with us. So Sarah from Barnardo's, we have one of the dads workers from Children and Families hubs, and Newcastle United Foundation, North East Young Lads and Dads, Tiny Lives, and Little Minds in Mind. So there's a whole range of services there that dads can obviously find out some information about that might be helpful to them and their families. When we were approaching people, as I say, a lot of the dads still seemed a bit apprehensive, didn't feel it was for them. So the last event previously, which was just the 13th of June, I got that sent out via Barnardo, which is our maternal notes record keeping system that we're now using in Newcastle. So we don't have handheld notes anymore, so we can send out push notifications, and maternity agreed that we could send out a notification to say when we were going to be there. So previously with the events quarterly over the last year, we've had maybe 3-4 dads that we've sort of managed to get into the room to have conversations. And then we've sort of gave out goodie bags and information leaflets to the other dads on the unit. But with incorporating the Badgernet notification, we actually had lots of dads ring up and ask about what this event was, how could they come along. And this time we had 15 dads attend the event, not necessarily attending the hospital for an appointment. They were coming in just to attend the event itself. So that was fantastic. Hopefully that will only continue to increase. The conversations that we've had, so as I say, the purpose of them was to talk about health visiting services that are specific for dads available in Newcastle, and about things to do with having a baby. So, that 1,001 critical days period, the importance of talking to their baby, interacting with their baby. And some of the conversations that we've had on the back of that have been fantastic. As Sarah mentioned earlier, with those safeguarding issues or the child death reviews, it's come up that there's been a lot of either misinformation or it's been accidental harms where dads haven't known about safe processes. And one dad came in and he was really enthusiastic about becoming a dad for the first time. He was telling us all about this research he'd done, and he'd been watching everything that he could get his hands on YouTube and things like that, and that actually he'd known from this YouTube video that the most important thing to do was to leave your baby in a dark room by itself, and that was the best thing for that baby, so that it wasn't getting too stimulated, it wasn't getting spoilt with sort of too much attention from parents. So being able to have those conversations to say, actually it's the opposite to that. We want the baby to be around you guys as its primary carers, and the importance of having that interaction and that reciprocity between a parent and a child, and what difference that could make. So that dad went away then being properly informed. He thought he was doing the right thing with the information he'd found, but he hadn't spoken to anyone about it because he hadn't had the opportunity. He hadn't been to any of the midwifery appointments that his partner had had so far. So having those kind of conversations, it can just, I think it's just not acknowledging the fact of how impactful that could be to that child's well-being, but it would have been completely you know, he's doing everything with the right intention. So we've got a couple of remaining dates for this year. We've got the 10th of September and then the 5th of December. As I say, they're on the maternity unit. The hope is that in the future we can expand that, maybe have a bigger area within the hospital, and also invite dads of over 5s as well to come along and speak to us. Can I have the next slide, please? Thank you. So as Sarah mentioned earlier, we've got the Dads Champions in Newcastle, which is going fantastic. The purpose being that, you know, we can share best practice, we can highlight services that are available for dads, and be able to share information with dads so that they do feel informed in the same way as mothers do. And even if they're not at that appointment, you know, we can still get those specific messages, and we're not just using the mums to pass that information on. We need to be giving them that information firsthand. We know that dads and wider family members can be great supports for babies and children, as Sarah and Judith mentioned, you know, about taking a village. Totally agree with that. I think what we need to look at though is we need to make sure that we're supporting that dad. They're not just a sort of bystander or, you know, a support to their partner. They also need that support themselves. And I know Sarah briefly touched on birth traumas. You know, as a midwife, we have a lot of dads who are stuck in that in-between stage of, you know, they're not the patient, but they're also not the visitor. And how do we sort of work with them to give them that information? Can we have the next slide, please? Thank you. So, as Sarah mentioned briefly, the reasons why we feel it's important to increase our engagement with fathers, because of the increase in the infant deaths in the North East over the past few years. A lot of the information we're giving to mothers, we give out a lot of information at midwifery and health visitor contacts. Too much to remember, to be honest, but we have to have all of these messages in, you know, about safe sleep and feeding and mental health and things like that. So I think it's very hard to put that upon mothers to pass all that information on and remember everything that we're saying, to give those right messages. So the 5 key areas that have been identified within these sort of serious case reviews were infant feeding, safe sleeping, the role of the health visitor, first aid, and ICON, which is coping with crying and reducing that risk of or what was previously known as shaken baby syndrome. So on the back of that, and as part of the Dads Champions group, we want to develop a resource pack for dads and male carers. So the resource pack will be available online, but also be in print. We want it to be accessible and engaging for dads. Sarah and I spoke to someone from a national dads charity who said, you know, dads really would prefer just something very small, very concise, but we also are aware that we need to be able to share significant messages with them. We looked at a few resources nationally, but that were very wordy, very lengthy, you know, sort of 80 pages long, that we know we're not going to have dads able to sort of use those quickly. So our resource, we do want it, it will be longer than unfortunately the A5 piece of paper that we were sort of recommended, but we're talking sort of 15-20 pages of easy read pictorials, a page to each sort of topic, and then signposting to services or contact numbers. But obviously there are very Newcastle centric, very Newcastle specific, rather than being a national resource. And then, as Sarah mentioned, that'll be online too, so we can update that regularly. But we did feel it was important to have a print copy as well for dads who don't have access to the internet, or, you know, who might need, who might not be able to read information online very well, so would prefer having that sort of physical handout. And the purpose of that would be to, the aim of that would be to be handed out either at midwifery appointments, in early pregnancy with the health visitor, or places like birth registration, ideally if they haven't received that already. Can we have the next slide, please? Thank you. I know this slide's very wordy, but it's just, with the slides being sent out to you afterwards, this is what we're going to include in our dad's resource, and all the information that we want. So to start with, obviously an introduction and congratulations. The reason this is set out like this is because this is how we've sent it out to our Dad's Champions. It's a true collaborative sort of piece of work. We want everyone to be involved in different sections if they've got specialist interests, but we're not rewriting the wheel here. We are using information that's already out there from reputable sources, NHS, Lullaby Trust, those sorts of places. But we feel it's important to put a congratulations in there. Congratulations on becoming a dad for the first time. We've spoken to sort of a few young dads charities who say, even as a young dad or a teenage parent, the first thing that everyone says to that sort of group of dads is, "Oh, what have you done? You've ruined your life," sort of thing. And actually, we need to change that message. We need to be telling them, congratulations, you're going to be a dad, and that's great. That's already happened. So we want to start them off on that good foot of, oh, this is exciting, and I can really make a difference with this. The other things, I'll not go through everything, but about bonding and attachment, we know that babies and children who have father figure in their life, obviously not all families are made up the same way, but those who do have a father figure, there has been research to say, their school readiness levels at 5 and educational attainment at 7 is improved with dads who are reading to them or who are spending time with them. But for some dads, it's very difficult to know how to play or engage with their children, and it's about how can we give them some top tips of things that they can be doing. Going on to things like their employment rights and their benefits, sort of legal rights and support. If, as Sarah mentioned, there's those situations where families are separated and they're having to go through court proceedings for access and things like that. We're going to look at the health side of things as well. So talking about the stages of labour, we know that there's a lot of dads who suffer postnatal depression on the back of birth trauma. I used to be part of the working group who facilitated the birth reflection sessions in the hospital, and they were always really beneficial when the dads attended. The dads got a lot out of them. However, they're not advertised to dads, if you like. We speak about it to mums and say dads can come along, but obviously that appointment has to be initiated by the mother. It's her medical records are used to discuss that process. But dads who've attended have found it really helpful. So talking about what to expect, who might be involved in that care, what might happen during the labour, so that they're not stuck in that sort of deer in the headlights situation. Things that their baby needs physically as well as emotionally. So we talked about that brain development side of things, but also things like what do they need to take into hospital, what supporting equipment, and also what don't they need, because as dads tell us that there's a lot out there they don't know. They think that they need to have everything for this baby, and from the research that we've seen and the conversations that we've had with these specific charities, dads are saying, they want to feel useful, they want to feel helpful, and that means buying things or providing things or helping, but they don't always know how to do that, or they don't always feel they don't know how to do that. So being able to give them some tips of, these are the things that you should take along. How to support your partner as well as being supported yourself. So how to look after you. So talking about things like sleep deprivation and how that might impact on returning to work, what support you could get, and also about domestic abuse. So we're very I think we're very good at asking women routine inquiry for domestic violence, but we don't tend to ask dads that. One, because we don't always get them alone. Oh, sorry, my light's gone out in this office. We don't always get them alone, but two, it's not thought of as much. Yes, we know that a lot of domestic abuse cases will be a female victim and a male perpetrator in that sort of relationship, but we're not actually asking the question, and also we're not finding out that information from male victims either. And then going on to say feeding and safety, as we mentioned earlier about the safe sleep and safe car seat use, importantly that out of routine. So if they are having the baby in a different staying over with family members, or if they're a separated household, just so they know what things they need to look out for, or where they can seek support using things like the Healthier Together app, or the Little Orange Book, or our single point of access for health visiting, which dads can obviously contact as well. But we do get mainly mums calling us on. So that'll all be available, like I say, in print and then on that landing page for Children and Families Newcastle. And hopefully we'll get professionals really signposting to that, so that all that information's there for them readily, and they can just flick through it as and how they need to, basically. Next slide, please. I think that's me done. Fab. Yeah, so that's everything from me. I'm going to hand over to Laura.
Thank you very much, Sarah. And yes, we'll go straight into Laura Toher, who's the clinical educator of the 0 to 19 service. So over to you, Laura. Thank you.
Thank you, Judith. Am I doing okay for time? How much time?
We're a little bit behind, but I hope everybody present, the richness of the presentations is so incredible that I think we should take the time that you need. We have plenty of time for discussion, and I will give everyone a 5-minute comfort break after the talks. Thank you.
Okay. Good morning, everyone. I'm Laura Toger, the clinical educator for the Newcastle 0 to 19 service. I'm a health visitor by background, but I work across the whole of the 0 to 19 service. Next slide, please. So I came into post in June 2023, and what I saw when I came into post in this service was that we were working collaboratively as part of Children and Families Newcastle. We were committed to that model of relational practice. We had an innovative service model in our service, in the 0 to 19 service, which meant that we were doing really well in terms of recruitment and retaining staff. We were working with our positive culture of learning, which included the positive encouragement of quality improvement projects for all staff across the whole skill mix team to be involved in quality improvement so that we could identify and celebrate best practice. We had a father inclusive practice working group, which Sarah was on. We were positively engaging with Sarah Robson to be able to strengthen our practice around that. And I've already said, working collaboratively in relational practice models. Next slide, thanks. We had also started to roll out the update of the new Healthy Child programme, which changed the terminology of the Healthy Child programme for the 4 levels of intervention. So moving away from our old terminology to the new terminology, which is community, universal, targeted and specialist. So this means that we provide universal services to all families as part of the Healthy Child programme, but the way we do that is personalised. So we work on a community level, engaging with Children and Families Newcastle and all the services within our service area. On a universal level, we deliver the core contacts and our universal provision to all 0 to 5-year-olds and 5 to 19s in the city. And through that universal contact, when we've identified health needs, we then work in a targeted approach in an individualised way to help each child or family meet those health needs. And where needed, we provide a specialist level of intervention. So this means we're working as part of a multi-agency response to support the health needs of a child or a young person. We do that through our universal core contacts, and we're always working around our high impact areas of the Healthy Child programme. So that just gives you a little bit of the context around what we were working on when I first came into post. I also did a training needs analysis of the service, and we had a 3-year plan put together for what training would look like over the first month, 3 months, 6 months, over the first year, and then up to 3 years as well. So in terms of father inclusive practice, we already knew from the National Safeguarding Practice Review Panel report in 2021, The Myth of Invisible Men, that universal services weren't doing enough to assess and support the transition to parenthood for dads and male carers using a strength-based approach. So that was the national document that gave us that evidence. And I have provided my references at the end because I appreciate that my slides are quite small there for you to read that evidence base. We also knew from high quality systematic reviews that we weren't doing enough to give fathers advice, guidance and support around their transition to parenthood, and that fathers were requesting more advice and guidance specific to them. We knew from evidence that involving fathers in practice benefited the long-term outcomes of children. And we also knew from systematic reviews that it also improves the outcomes for mothers, more specifically around breastfeeding and maternal mental health. So as health visitors and school nurses, we already knew this evidence base. In the Newcastle 0 to 19 service, we were already working proactively, as I said, with Sarah, with our Father Inclusive Practice group. Sarah Robson had attended our professional development forums to upscale our workforce around current issues. We were seeing dads engage with us in our universal level of provision through antenatal workshops. And we also had examples of good practice where practitioners would contact fathers by telephone if dads hadn't been available at the antenatal contact. Next slide, please. So I thought we were in quite a strong position in the Newcastle 0 to 19 service, and I attended, after being quite early into post, I attended an early workforce development group in the city. So this was a new working group that was put together by one of our colleagues in Newcastle City Council to work collaboratively with myself and Newcastle City Council and other wider services around how could we support and educate our workforces, sharing resources and sharing best practice. And it was in one of these meetings that I met Sarah Robson, and we were sharing examples of best practice in the 0 to 19 service, when Sarah very positively brought some learning to the table. So since then, I've always thought of Sarah as being a positive disruptor. She's a fantastic example of that critical appraisal that she brings to discussions, raising awareness around father inclusive practice and really highlighting the gaps. So through that discussion, Sarah was able to share some real examples from her dad's champions about barriers that practitioners in Newcastle were facing when they were trying to work positively with dads and male carers, and some of these examples were from the 0 to 19 service. So following that meeting, I was able to come back to the 0 to 19 service and speak to our service lead and our deputy service lead at the time about what could we do to strengthen our father inclusive practice. And one of the things that we really wanted to work on was the systems and processes, which is what Sarah had highlighted would be best practice and would mean that sustainable change. We could make sustainable change in the service. So I came back and I raised that. One of the issues was our documentation of our contacts with fathers, and our service lead identified that there was a piece of work that was ongoing and about to be released to staff around a change to practice in our standard operating procedure of differentiating between children and parents' records. So if I could go to the next slide, please. So at the back end of last year, we were working in the service in differentiating our record keeping. In the 0 to 19 service and all NHS services, we've got a legal requirement to document all of the care and all of the contact that we have with children and their family and carers. It was practice at the time in our service that we would document all of our care on the child's records. So during pregnancy, we would document all of our care on the mother's records. And then once the child had been born, we would document all our care on the child's records. However, we were already changing our practice to differentiate that record keeping between mothers and babies. So a mother's record would be open to our service at the point of them being referred in antenatally. We would then discuss consent around that record keeping when we have our first contact with mothers. And our new practice, our change to practice would be that we would continue to keep that mother's record open along with the child's until we finish that last universal co-contact with the child. And at that point, we would close the record and we make sure that all mothers are aware of that information from our antenatal contact. Because we were rolling out that change in practice, we were then able to advise practitioners that if we had a father's consent or a male carer's consent and we were doing a piece of identified work with them, with their consent, we could then open their record to document that information. This means that for practitioners, we are doing a little bit more work in terms of record keeping, because sometimes we might be documenting things in 3 records, for example, or even more if siblings were present as well. But it really is best practice, because it means that when we're documenting in a mother's record, in a father's record, when they are engaging with other services who also have access to their System 1 record, to their NHS record, then other services can see that information. So they can see that the 0 to 19 service are working with them, and we can update their records with current information as well. So we piggybacked onto the back of that change with a father inclusive practice lens. So we keep all mothers' records open until that last core contact, when the child is aged 2 to 2.5. And then if that child doesn't need any further provision, the mother's record is closed at that point, but can be reopened if we're working with them. The child's record stays open on a universal provision. If we're working with a dad or male carer or another carer of the child with consent, we can now open that record so that we can document their care. And then once that piece of work has concluded, we would close that record. So we're not keeping records open. Also, we have been going through a digital transformation process in the 0 to 19 service. So it was identified that we needed to update our use of System 1, which is our safe record keeping database. We haven't just updated our templates around that, we've actually built our own. So we formed a working group with the System 1 and digital health team here in the Trust. We looked at what was happening regionally, nationally, what national policy asked for, what our local commissioning asked for, what were the identified health needs of children and young people in the area, and what was best practice from our service. And we developed our own templates which support record keeping, differentiating of those records, and also models best practice. So if you're new into service, the record keeping process itself models to you what best practice is in terms of delivering the Healthy Child programme. Because we've built our own database within System 1, we've been able to do it with that father inclusive lens. So for example, where we would have had templates for mothers' records, we've now made these non-gender specific. We were able to critically appraise what we were doing with the father inclusive lens. So for example, sometimes we might naturally gravitate towards supporting mothers around maternal mental health, and we've been able to question that and ask, well, what's that about? Does it need to be maternal mental health, or can it be parental emotional well-being? We've been able to look at that mother's template, which discussed breastfeeding, care of your breasts, sexual health, your pelvic floor, infant feeding, your transition to parenthood, your relationship with your baby. And we've been able to actually recognise that all of those conversations can be relevant to a father as well in an individualised approach. So those templates are now non-gender specific. From a service delivery point of view, we've really looked at those new levels of intervention of the updated Healthy Child programme and asked, do they need to apply just to the child or the young person, or could they apply to the adult and carer as well? For example, we might be working with a parent or a carer around encouraging them into smoking cessation or around their emotional well-being. And in that case, that's a targeted piece of work for that parent and carer. It might be that the child doesn't have any health needs, although we're working with the parents and carers to promote the child's best outcomes, or it might be that the child does have health needs as well. And because we can apply the level of intervention to children, young people and their carers, that means we can profile work and we can put staff in the areas of the city where we need them most. And finally, we've been looking at how we record the groups and relationships on our database as part of our digital transformation. So we always update our groups and relationships of people that are significantly involved with children every time we see a child, but it wasn't mandated on the records. And we've now made that a mandated field in the children's records and in the adult records. So this for dad means if we've got dad's record open with his consent, we've also updated his groups and relationships It's very visible in his record that he's the father of a child and that he's getting support from the 0 to 19 service. So like I said, if he's accessing other services, for instance, if he attends an urgent treatment centre or if he goes to his GP for support, they can see that he's actively being supported by the 0 to 19 service and that he's the father of a child. Next slide, please. So that was the changes that we brought about. We've been really, really busy, but we've still got more work to do. It's really early days. We know from the report from the Fathers Institute, the recommendation from that is that all fathers would have their records open universally and that all fathers would be documented on the new birth notification, so that when other services receive that new birth notification, such as the 0 to 19 service and GP practices, we would be able to see who dad was from the very beginning of that baby being born. That's not current practice at the moment, although if we have got those details, it is there. But we're doing more work around what would it look like if we were to change practice and open all records universally. That's a really big question, and we're not there yet. And I think it's a national question as well. But it definitely is. It is there. We're looking at how we provide education and competency for our staff around father inclusive practice, and that's something that I really hope Sarah and Sarah will be able to support with, and hopefully that could be a collaborative education package for all services in Children and Families Newcastle. And we're also looking at increasing our reach to dads for all levels of intervention. So at the moment, we're opening dad's records if we're working with him from a targeted or a specialist point of view. But as I said, we would really like to do that for all levels of intervention. And so what that would look like would be that if dad wasn't present at any of the core contacts, then we would make sure that we contacted him in another way so that he still received that information. So that's where we would really like to get to. Next slide, please. And that's just my references. If anybody wants these slides from today, that's all the evidence base that's supported the changes that we've made. Thank you.
Thank you very much, Laura. That's really incredibly brilliant detail around the changes you've made to the 0 to 19 services. Sarah, could I come back to you, literally, I'm afraid, just for a couple of minutes, just to lead us into the discussion that we'll have after the break in terms of next steps and how do we translate all of this wonderful thinking and evidence that you've all been able to show us today into actually the doing. So Sarah, over to you just for a brief next steps, and then we'll take the break.
Thank you so much. Yeah, so we can talk about the theory, we can talk about how we can evidence the amazing work that Laura's done, and until you start having those conversations on a national level, I don't think it's appreciated the sort of enormity of the changes that Laura has made and is continuing to explore. The work that Sarah's doing from critical days sort of perspective and also Solihull approach. So how do we make all of that actually change and work within our services? And I feel like Sarah and Laura have done a lot of the work for me on this bit, so I will be able to go super quick through it. Could I have the next slide, please? So we talked about systems and processes, policies, procedures, what guides us, what restricts our practice. We talked about systems change, what's in our power of control to influence, and how do we enable an evidence engagement with non-resident parents in a meaningful way. So how do we capture that information? Contract monitoring to be contract compliant, something about accountability depending on what is written into your contract of the service that you have to deliver. Case management, auditing. Next slide, please. The tools that we use, the visual prompts that are in forms, and that Laura has talked about, there's a section within their processes on systems where you can't actually proceed any further until you've completed all of the fields. That's such a brilliant prompt for people to ensure that they are capturing dad's details. Risk assessments, let's critically think about how we assess risk. We are risk averse. And we are more subconsciously aligned with mother being the carer, nurturer. So let's explore being different about that. And feedback tools, who are we sharing that with? Who are we capturing feedback from? Because quite often they might be sent out to mum and not to dads and male carers. Next slide, please. And staff support and development, the induction process, I know Laura's touched on this, embedding a think dad mindset from the start, training, thinking about the language that we use. We need to say the word dad more often is what we've learned from national practice. Supervision and opportunity to be curious with our staff and support them when there might be a subconscious bias that's impacting their work and the cultural environments that we work in. Next slide, please. So just to go into the break, I wanted to share this statistic with you. 19,122 children aged 5 and under in the city of Newcastle as of April 2024. That just gives us the level of enormity of small people that we have running around our city. So before we go into the break, I would just like to ask the question, with that number in mind, where is Dad? Thank you.
Wonderful. Thank you so much, Sarah. So we will take that break now. Thank you to each of our speakers for really setting the scene incredibly well for, I'm sure, what will be a rich discussion. So 5 minutes break. Please come back at 11:20, and that gives us about 30 minutes for discussion. In the meantime, please do use the chat if you want to put your comments in, but please, I'd like to encourage everyone, maybe if you are feeling comfortable, to come off camera and to ask their questions once we come back. See you at 11:20. Okay, everyone, welcome back. I hope you managed to grab a coffee or use the facilities in that time. Sorry, it was only 5 minutes. Welcome back to the Child Health and Wellbeing Network Huddle on Father and Male Care Inclusive Practice. We've had excellent presentations that have really set the scene for us. So I'm hoping you've got lots of questions and comments to our speakers. And as I said earlier, direct questions about this work is fantastic, but if you've also got your own work that you can contribute to the discussion, that would be really great as well. I wonder if we could stop sharing the slides just for now, just so I've got everyone on screen and can keep in touch with who's putting their hand up. So please do either use the chat or come on, raise your hand so I know who wants to ask a question. And if you do ask a question, if you would be willing just to say who you are and what your role is, that would really be helpful for everyone as well. So I don't know if who wants to start us off. Any immediate questions come to mind? Ange, I don't want to pick on you, but I see you've got a really good question, and thanks, Ange, very much. If you could come in now, brilliant.
Judith, Sarah, I think across all three of you, just a fantastic amount of work has happened, and it really is a masterclass in the art of the possible. And I know this stuff takes time and it's hard, and there's sometimes really small practical things that need to happen, and as you start to unpick it, you realize there are 100 other little small steps along the way. So just really nice to hear that level of detail today. I'm really interested, Sarah, you've generated so much information around the gaps, whether anything has come up in that gap around independent advocacy. And I guess I'm thinking about fathers and their contact with early help, safeguarding challenges around family courts, whether independent advocacy is something that's come up as a gap in that space.
Hi, Ange, thank you so much. Yes is the answer. That's quite a concise answer for you. On every level, we've spoken with national offers where they are offering advocacy from the point of maternity, midwifery for dads. We've also had long conversations with how we provide advocacy for dads who may present with neurodivergence and how we support them to process the systems that they're going through and the transition, which is possibly the biggest transition you'll ever have in your life, which is becoming a parent. As far as support within legal systems and children's social care, we're working with social care to look at their practice. Laura and I have just had an email yesterday inviting us along to collaborate with Newcastle Children's Social Care on their policies and systems that they use. Within courts, we've got the amazing Northeast Law, which we can access for free, independent legal advice. They are super keen to work with dads. However, they do not offer free legal representation. So there are a number of dads representing themselves through the court system, which is incredibly stressful. And as far as what support looks like for them in that is questionable, depending on what family they have around them. As far as the community hub family offers are, then we are working with all of the community family hubs across the city with getting it right for dads, getting the offer right for dads. We're exploring how that might be different from generic pathways into what might be groups or learning opportunities, which dads are telling us might not be such a good fit for them. We're also thinking about how we work out of office hours, how we diversify our delivery to ensure that we're capturing dads who might be working and unable to access services. So as far as independent advocacy for dads, I'll go back to my initial answer. Yes, the gaps are there.
Thanks very much for your question, Ange. So we've got a question in the chat. I don't know. This is from Rebecca Tulip. I don't know, Rebecca, if you want to come in. I'm happy to read it for you. So this is: will education around baby immunisations be included for dads? So I suppose either Sarah Cartner or Laura. I wonder if you want to come in on that. Maybe Sarah.
Yeah, thanks, Judith. Yeah, Rebecca, we've already put on there that we want to include immunisation information, because we also know that there's been babies who weren't brought if they've had separate households, they've not been brought for immunisations, and then future conversations, the fathers weren't actually aware that they weren't brought for the immunisation or what it was for. So yes, we'll absolutely have sort of the routine schedule, links to the schedule as well as talking about other immunisations for certain groups. So babies who might be exposed to Hep B or who might need BCG vaccination, depending on sort of ethnic origin. So that will all be in the resource too.
Thanks very much, Sarah. Laura, you've put a couple of notes just in the chat. I wonder if you just want to maybe update with some of the other even more work that you're doing that you've talked about in the chat.
Yeah, thanks, Judith. I just forgot to mention that as part of the next steps, we've got this widening access project in the service, looking at how we widen the diversity amongst our workforce so that we can better reflect the community that we serve. And so at the moment, I'm working with Newcastle Hospitals and Northumbria University around recruitment of internationally recruited nurses into the trust, but we really need to take that wider as well and to be including the father inclusive lens around that. So the starting blocks for that is that we're going to be working with some fathers in the city, hopefully to invite dads into our recruitment process and onto our interview panels so that they're having a say in the practitioners that we're employing. And then also looking at linking Sarah in with Northumbria University. So as well as providing education to our staff once we employ them within our service, but going beyond that to provide more of a father inclusive lens into the pre-registration nursing training. And also thinking about how we widen access onto the nursing training as well, so that we're recruiting more males onto that.
Thank you very much, Laura. Excuse me. So while people are thinking of questions and comments, I was struck, Sarah Robson, you made reference to the fact that not all mums might want the service to know who the dad is, etc. And obviously that's a real block in terms of some of the work that you've described that you want to do. And I suppose what happens in that situation? What can we do to try and encourage mums to sort of share that information?
Yeah, I wish I had a golden answer for you in that case. And unfortunately, what we're finding is that mums will just not share who dad is. I can give one example of a mum who told a practitioner that the dad had died. The practitioner knew that the dad had not died. That was just the level that mum would go to, not to share that information and have them involved in their child's life. But what we hope to do is by the conversations like the one that we've had today is change that going forward. So for the new generations of babies that are born, we will know from the point of pregnancy who father is. That mitigates all of those barriers, all of those challenges, because the power is taken away from the person who holds the narrative. That applies to mums too. I quite often worry that I sound like I'm all for dads and not for mums. I'm not. I'm for people, because people carry risk and people also are protective factors, and we need to stop aligning that with gender.
Thanks very much, Sarah. And we'll move now to another Sarah, Kerrigan. Thank you.
Hi, yes, sorry. Hello, everybody. My name is Sarah Kerrigan. So I put a little bit in the chat, but I am the service manager for commissioning services for children and families at Newcastle Council. So this is a piece of work from Sarah and Laura that we are extremely excited about and really, really keen to help support. And I suppose I just wanted to add something from a commissioning lens and about why I think this work is it's been so important in Newcastle, and it will be so important everywhere sort of going forward, is that what we are learning as commissioners from our Dads Champion Network and from the feedback from people like Sarah and Laura is that it isn't just about sharing information with dads and making sure that dads have all the access to information that mums do. And it isn't just, and I say just like these are small things, about making clear and valid the role that dads play and recognise that and sort of and hold that sort of front and centre. But one of the really key lessons for me, and I don't have any answers because nobody would expect me to, but the Dads Champion Network will be helping to feed this through, is that it's not just for us about how we make our current offer, which, let's face it, we learn is very much aimed at mums and female carers and their young children in that early intervention space, how we make that offer accessible to dads and male carers. It's about how we make it resonant and relevant. And there's been some lovely things that I've been scribbling, writing down through the presentations about how men communicate differently to women. You know, we can't expect that everybody interprets information the same way or derives their social support in the same way. So the way that things are structured, you know, come along to a group and we'll all sit around and we'll talk about our shared experience. Not everybody interacts like that. So how do we build an offer that is tailored to the different genders and inclusive of everybody? So for me, that's one of the really exciting development pieces, because we're about to go into our redesign and sort of the next phase of our procurement of what our early intervention offer looks like in Newcastle. And this learning is really, really crucial. It's not just about making sure that dads know when all the same groups are on and the same activities that are on for mums. It's about finding out, I think Sarah said it at the beginning, even if you change the venues and the times, why doesn't the same stuff hit the mark? And it's about getting under the skin of that. And the only way we can do that is by having dads champions who are engaging with dads about the offer and feeding that back. So we're really excited about this. And I just think we need to clone our dads champion network and make sure that they're everywhere. It's great. So I just wanted to add that from a very self-interested service design perspective. If we want to get under the skin of why the male population are on the Family Hubs and Start for Life programme, they are described as a hard to reach or hard to serve group. I mean, that blows the mind. This is half the population, hard to reach and hard to serve in this space. How do we get that intelligence about what a really resonant offer feels like for dads? And that's why I'm so excited about this. I'm sure you can tell, because as soon as I'm excited, I start talking with my hands. I'll stop now.
Sarah, do you want to come back on that point, or is it a different question?
No, yeah, I was just going to say,
Okay.
yeah, totally agree, Sarah. I think the issue that we've got is that it's much bigger than us anyway. It's much bigger than this and the work that we're doing. It's a whole, you know, the whole rhetoric that's societal and those gender stereotypes, you know, that we're still perpetuating that that story of mums and babies and your health visitors for your mum and your baby. And you know, we need to really change that, and I think we can only do that by those bigger messages getting out there, you know, those like sort of the national campaigns and things like that, and getting dads, like Sarah mentioned earlier, pictures of different family makeups, you know, not just that sort of mum and dad or mum and baby and those lovely nurturing looking pictures. We need dads to be able to see dads doing skin to skin and attending clinics and all of that sort of thing, which we're obviously far away from, but that's sort of what we're aiming for, I think, here, as a starting block in Newcastle. And we really want to pave the way for that, because I think there's so much good work that we're doing here that isn't happening. We you know, me and Sarah know from conversations we've had with other areas that it's not happening in those areas. So we are really at the forefront of you know, making those changes. But it is going to be bigger than us, but hopefully we'll keep plugging away at it.
Thanks, Sarah. Could I just pick up on that point, maybe, and for all of the speakers to get their views on it. So it's fantastic to hear that Newcastle is the real trailblazer in all of this work, but how do we get it taken up in other parts of the system and you know, nationally? What is it has to be done to move from excellent practice locally to much more spread across the region and across nationally, as I say? Any thoughts from any of the speakers on that?
I think for me, just from conversations that me and Sarah Robson might as well have a hotline to each other, but from conversations with me, Sarah and Laura, you know, it's just about continuing to spread that message. Like Sarah and I talk to anyone and everyone that we can about it and try and get them involved, and it's just about that networking, that keep pushing that message out of what we're doing and why it's important, to sort of share. You know, we don't think that nothing that we're doing really is original thought, if you like. You know, we've known all of this research for years about dads' interaction with services and what dads feel they need, but we're still not doing it. So we just need to start and enact on it, I suppose. And we can only do that little bits at a time, like Laura said, with the system changes that we're making within 0 to 19. Yes, we can try dads groups and things, because I think we still need to put them out there as an option. Some dads do attend them. You know, we do have a few dads on like the parent carer panel, but it's just how we sort of make them feel included. So, you know, there's a lot, we get a lot of comments about, you know, well, everything needs to be inclusive of different family makeups and things, and I think that is right. However, we also need to acknowledge that different family makeups are unique in their own way, and actually we don't want to lump everyone together in one big group just because they're a family. We need to say dads have these needs, same-sex couples have these needs, or trans families have these needs, and actually really work with what they need from us, not just saying, well, we just want to look like we're being inclusive, so we're going to lump everyone together as one big group.
Thank you, Sarah. Sarah Robson, do you want to come in there?
Yeah, just on the back of what Sarah was saying there, absolutely everything above. I would say as well that we are really fortunate in Newcastle that we have the full support of our commissioners behind us, and they're so invested in this piece of work. And it actually really brings to the forefront for me a family that we spoke to where they delivered baby in Newcastle, and they actually had to stay on the NICO unit with little one, but then when they left, they were going back to a different local authority area where the commissioning and the investment was completely different. That was going to look really different for them. And that always stays with me a little bit, because I feel like we have so many families who come to Newcastle to have their babies, and we offer this amazing work, this engagement, this investment. But what does that look like when they go back to where they live? And like I say, quite often it does come down to commissioning and allowing the space for this work to happen.
Thank you, Laura.
Yeah, I just wanted to come back to your point, Judith, of how do we take it wider? And I think for our service, it's just being willing to continue to be part of the conversation. And our service leads, we're so fortunate that our service leads really champion us being part of that, and also being part of like national events. So we were at the Institute of Health Visiting Conference last week, sharing some of our best practice in the service around FGM and early help for families who are homeless. And I think if we use PDSA cycles around our father inclusive practice changes, and if we engage with service users and hopefully branch out into research, then we can use that to be able to share that nationally.
Thank you, Laura. So what strikes me there is you really are trying for this to be inclusive, and your examples there, Sarah, of, you know, traditional families may not exist in the same way as they used to. And I was thinking about whether there was any cultural aspects to this. So have you engaged with dads from different ethnic minority groups, for example, to understand their culture and how they would approach it, and then how they could be supported in that in inclusive practice? Sorry, Sarah Cartner, that was two.
Thanks. Yeah, so we are very fortunate in Newcastle. We now have through our North East Young Lads and Dads, one of the charities that works in Newcastle, they have introduced a dads and male carers ethnic minority worker. So Sarah and I have met up with Fred, who's coordinating that, to sort of talk about how we engage with those dads and what are their needs. Fred's got a long history of working with young people. That service, unfortunately, is for under 25s and under, which obviously we want to then just expand to dads of all ages. So something that I will also be looking at, that I've started touching on but we haven't been able to progress with yet, just because we've got so much going on, is speaking with local faith leaders, and, you know, getting their sort of insight on what families need, whether that's for a dad or for the mum, or just as in the family in general. What are their sort of preferences? What could they what would they want from us, basically? What would they want us to deliver? So yeah, it's absolutely been a consideration in what we're doing. And then the hope being that putting our resource on the Children and Families website is that it can be translated obviously into different languages, used with different services, and then we'll hopefully get that message out once it's developed once it's ready for sort of to be distributed, then we can work into VCSs and, you know, speak to them about it so they can be signposted to them too.
Thank you. Thanks very much, Sarah. So a couple more points from me. Just please jump in with your hands up if anybody else wants to ask a question. So it was referred to earlier on about the role of the workplace, and I work at a university which is desperately trying to sort of bring in new policies, etc. It really supports its colleagues so that they can bring their true selves to work, but also they're supported when they need to take leave, etc. So I suppose my question's in two parts. What do you think the role is of the workplace in supporting fathers? And also, do you have particularly good examples that you're aware of that, you know, best practice that could be shared in this space? That's for anyone who wants to jump in.
I don't mind starting off. I mean, that is just amazing. And quite often what we're finding is that it's down to individual services, what their offer is. We have that government guidance around 2 weeks paternity leave. We understand what that actually looks like for dads who are actively engaged in babies who aren't sleeping, who are trying to support partner. We understand all of that. I think sometimes when I'm speaking to people, I don't always have the answer, but I would pose the question, what would you do for a mum? So if a mum needed to go to an appointment and she said, I'm sorry, I can't make that meeting because I've got a hospital appointment for my little one, would that look the same for a dad? I would also think about sort of the entitlement that mums have around the extended leave that they have when they have a baby, and sometimes a phased return back into work. Is there ways that could be worked around? You know, could there be a phased return for dads? Could they take 4 weeks off? You know, could they have flexible working patterns when they are back in work? Really interesting learning from LinkedIn for all of the ladies in the room is that as long as we perpetuate that kind of misconception around mother is the carer, and we will make all of the allowances, and potentially she's going to take more time off because she has to look after her children, and dad is the provider, we're actually sort of leading into the gender pay gap, which is something else, you know, that as women we should be considering, is sort of like, well, actually, if dads had the same rights, we would have more opportunity.
Thank you, Sarah. And Sarah, Laura, would you like to come in on that one?
I think obviously there's a lot of work going on nationally, petitioning for greater paternity leave and things for dads, which is fantastic. And from prior to this role, when I was sort of a health visitor with a caseload, you know, I was having conversations with dads that were it was much more positive about the leave that they were getting from their workplace, that was obviously just provided from that employer. But that was really positive that things were sort of moving in that direction. But then I also have dads, like I had a dad I seen yesterday who's only getting 1 week paternity leave, you know, and it's things like we need to start much earlier. So for me, as the 1001 days, you know, the 1001 critical days specialist, I feel like we need to be teaching about the 1001 days in schools, to our students, to our universities, teaching professionals. So I know I briefly mentioned earlier about the Solihull approach training. So that's an approach to working with families. Citywide, we provide that course to any professional sort of involved with families. However, my vision is that we'll work more with services or organisations where babies aren't their business, but to teach them about the importance of that, because actually the impact that has on our society financially, you know, sort of returns on what we're getting from our workforce and things like that. We need to be starting much earlier, and it's conversations that, you know, I've had. So I sit on, I'm co-chair of the Health Visitor Advisory Forum nationally, with the Institute of Health Visiting, and we have conversations there. I've been down to the House of Lords, and it's, to me, I mean, obviously I've got a specialist interest, but to me it's still crazy that that people don't sort of understand the impact of those, that sort of 3-year period, if you like, and how that can benefit us, you know, when we're old. But actually we're not looking at these things for those babies right there and then. Yes, we are in the terms of the well-being, but actually it's how that's going to impact on our city and country in 50 years down the line, and those people having those comorbidities, and we need to teach that, and the importance of the family interactions, the importance of the attachments, not just with the mum or whoever has carried that baby biologically. We need to be highlighting that before people even get to the point of having children or having employees who are having children and then needing to acknowledge it at that stage.
Thank you very much, Sarah. So I'm just going to check if anyone else has any final comments or questions, and then I have a final question for our speakers. No? Okay. So each of you, if you could change one thing, really difficult question, what would it be in terms of supporting the work you're doing and supporting father and male care inclusive practice? Shall we go, Laura? Shall we go to Laura first? Do it that way around this time. Thanks, Laura.
I would have more dads employed in the workplace in the NHS so that they could influence the training in the workplace and be involved more from an inside point of view, delivering the services to families.
Thank you, Laura. Sarah Cartner?
I think just asking the question, every contact that you have with a family, think dad or think other parent, whoever's not there at that appointment with that child. We need to be thinking about who else is involved in this child's life, and how we sort of interact with them as well to better outcomes.
Thank you. And Sarah, I'm going to give you Sarah Robson the last word on this one.
This is an amazing opportunity to really showcase Newcastle and the work that they're doing. So my answer would be to have dad's name recorded and attached to the child in the same way as the mother's, and for that to follow them throughout the child's life.
Thank you very much. So thank you to all of our speakers today, and for everyone for engaging and listening about this fantastic work. I think we've heard such incredible insights of the work that's going on. Wonderful as ever to hear that Newcastle is a trailblazer in this space. Enormous amount of work, and thank you all for sharing that with us. I had some of the way you describe things really stuck with me, and I'll just go through a few of them in the interest of time, not very long. The considerations that Sarah showed us in terms of life through a father's lens, I find really insightful. Comments about breaking the cycle, that's not what men do, and I think that's the whole stigma associated with what blokes do and don't do is so important at this. Tapping into the maternal and paternal family, again, what a wonderful way to describe exactly what we're trying to do here. And what was the other? And hearing about, Laura, Sarah was next, hearing about the engagement you're having with fathers right at the antenatal stage and all through that. And also the point you made about the misinformation, I really hadn't thought about it in that way, but it's really true. And we need to think really hard about what we can do about that. And then the Dad's Champion is such a brilliant initiative. And then Laura, listening to you about the 0 to 19 practice and how you're changing that and how you're really grasping this father inclusive practice within your 0 to 19 service was really, really interesting to hear about as well. So I'm going to hand over now to Jen, who's just going to tell you a little bit more about what's coming up within the network, and then we'll say our final goodbyes. Thank you, Jen.
Thanks, Judith. Hi everyone. So I'm Jen. I'm one of the network delivery managers in the Child Health and Wellbeing Network, and I just wanted to highlight a couple of resources to you which may be of interest through your work with families in the communities you work in. So the first one is Healthier Together, which some of you may already be aware of. My colleague Laura Cassidy leads on this for the network, and it is essentially a website and mobile app which is aimed at parents and carers, specifically of babies and young children, but also for some older children as well. And it is basically a means by which parents and carers can look at the symptoms that their child is experiencing when they're poorly, and it will guide them to the most appropriate course of action. So whether that is self-care at home, going to the pharmacy, making a GP appointment, or in an urgent situation, going up to the hospital to be seen. So it's sort of a two-pronged approach to ease parental anxiety and reduce pressure on services where it can, but also when a child does need to be seen urgently, it will guide them to the most appropriate service. So this is readily available now. Perhaps Amelia, you could pop the link to it in the chat for me just while I'm talking through the rest of it. And this is available to download as an app on Google or Apple App Store, on whichever sort of device you might have. It also, for a professional, has a very neat feature whereby you can text a link to a particular page directly to somebody's phone. So if you're working with a family and you want to highlight some information to them, you can send them the link to be able to find it themselves more easily on their own device. So that's quite useful. And then there's a whole professional section there where there's loads of information that we've collated on all sorts of different topics, including some resources compiled by the network. So if you want to have a browse of that professional section and see if there's anything of interest to you in there. So that's my little promo done, but hopefully you'll find that useful resource in your professional roles. And if any of you do have young children of your own, it will be useful for you in your own personal lives as well, hopefully. So do tell your friends and family about it as well. Thanks, Carol. And then from the network's perspective, we would really like you to continue to engage with us. So if this huddle today is your first experience of engaging with the network, you can become a member, as Amelia has already highlighted at the start, and that will ensure that you receive future communications from us. So that'll be other events like this, but also links to reports or opportunities to engage with different member organisations. We do have a membership that cuts across the system, so we're not just health, although we're based within the ICB in an NHS organisation. We do have membership from across the child health and wellbeing system, lots of VCSE partners, lots of engagement from education, local authority, public health, you name it. If they're interested in child health, you can be a member. So do please sign up if you aren't already, and then you'll make sure that you hear about more opportunities to engage with our work. Next, Carol, thank you. And that's just a little summary of links there. So when you do get this slide, you can follow those links to complete the forms, etc. And also to highlight the network of networks that Amelia leads on as part of the engagement work. This is an opportunity for you to make sure that we are plugged into as many networks of networks as we can be, so we can have direct contacts ourselves, but we're always much stronger when we can engage with people who know people. So if you are linked into a professional network, or if you have links to family groups or youth voice groups in particular we're really interested in, there's another form that you can complete there to make sure that we can make contacts with those people as well. And then if we have a specific issue that we want some engagement with, or a particular topic maybe, or a particular area of expertise, we can reach out through that network of networks. I think that might be it, Carol. I don't know if I had another one. Just back to Judith for her final comments. Thank you so much, everybody, for coming today. This, as Amelia said, this recording will be made available and circulated afterwards. So if you've got colleagues you think would benefit from having a watch of it, then please do share that. Thanks, Judith.
Thanks very much, Jen. So it really just leaves me to thank our speakers again, Sarah and Laura. Thank you for coming and sharing what is absolutely amazing and excellent work that you're doing, and really just to wish you all the best continuing with the work. I'd also like to thank Amelia, Jen and Carol, who organised these huddles, and there is a lot of work that goes on, as you can imagine, behind the scenes, so that they do flow so well. Do look out, we are planning in another huddle later in the year, so do look out for information about that when it comes out. And thank you all again for joining us today, and look forward to seeing you hopefully at another huddle in the near future. So have a good rest of your day, and thanks for joining us today. Thank you.